the DT, you wanna menage with a new body. So, be talking about the NHS Constitution. So, there are 6 values that the NHS abides by, which is number 1, working together for the patient. 2, respect and dignity. 3, compassion. 4, commitment to care. 5, improving lives. 6, 6, everybody counts. So improving lives is different to everybody counts. So if we start off with the 6 values, what they are, what they mean, and when I've shown an example. So working together, working with others for the patient. So this is basically collaborating with other NHS staff, effectively exchanging ideas to ensure that we can have good coordination to optimize patient care and deliver high quality care. I think I did this on my work experience when I worked in a small group, just me and my sonographer, where we were the radiology department, so it was part of a wider multidisciplinary team, and I really had to demonstrate good teamwork and skills in this. So this was just ensuring that I respected his role. I actively listened to him. I offered help when needed. Specifically, we had a patient where the sonographer was just kind of struggling a little bit to get the scan in. I think in this moment, I had to just sort of take over, calm the patient, and ensure moving forward, the patient just had that attention and compassion throughout. And we were just able to really seamlessly work through that setback. And then afterwards, we were able just to discuss on what went wrong and ways to improve further on. And also, it seemed that we also had like a common goal as well. Secondly, is compassion. I think compassion is very important. The difference between sympathy and empathy. Sympathy is feeling sorry for someone. So you're acknowledging their emotion. Empathy is putting yourself in their shoes. So appreciating where they're coming from, and probably, tailoring your action to sort of their feelings, which you feel validated. Compassion, I think, is the action that you then take in response to their emotion and needs and concerns. And I think it's showing and considering people's feelings and their situation. I think I've really done this through my role as, with the trans male. I think before the scan, he was a bit worried, but the fact that I was just able to tell him, we can take a seat, we can take a break, like we don't need to rush. And just kind of just sitting there with him was very important, because compassion is just the small things. And I think it's about not being judgmental and things like that, not being judgmental. Moving on, everybody being treated equally, everybody counts. I think this is very important when you ensure that nobody's discriminated against or at a disadvantage, and everyone is treated equally with respect. So I think the case with the trans male, I think, I was definitely upholding the NHS value of treating everyone equally, because I think people from the LGBTQ community often feel reluctant to go to the doctor because they fear prejudice or being judged. And I think it was very important to create that safe space while he was going through such a difficult time. And I just ensured that I respected that. And the NHS wants to ensure that we maximize resources to benefit the whole community and not exclude anyone. It's not based on your sexual preferences, your age. And I think it's also accepting that some people need more help than others. and that difficult decisions need to be made. And the fact that the NHS budget is quite limited, so you have to make sure that your ordering tests are necessary, and prioritizing patients. And if we are wasting resources or wasting opportunities for others, and I think that's putting other people at a disadvantage. Moving forward, high quality care. I think this is also important because patients need to receive high quality care as taxpayers, and we want to ensure that healthcare professionals are providing a safe and compassionate care towards every single person who uses the NHS. And this is quality and striving for the best quality care through effectiveness and experience at all times. I think it's also about encouraging and welcoming feedback from patients, and this is where the self-reflection is very important. And I think my job after each appointment was to conduct the patient information of attendance, where I worked, do a risk assessment of the area, ask the patient any further questions, and also take the feedback forms as well. And also, I shared this information with my department, who were able to re-share that information with GPs and things like that. Yeah. I think moving on from that, respect and dignity, showed this as my role as a care assistant. There was a case where a patient was upset, unable to concentrate. Let me use that example. Dignity is being able to listen to their concerns, take their feelings and their priorities into consideration, involve them in any decision making, and update them and keep them involved in conversations according to their health. I think it's very important that you treat them as an adult and value everyone and respect their aspirations, commitments in life, and seek to understand their priorities, needs, and abilities. And it's about taking others seriously. Also, being open and honest about your point of view, what you can and can't do, shows respect in that regard. I really like that bit about admitting to mistakes as well. Admitting to mistakes. And then lastly, improving lives. We must seek to improve the lives of the community and also ensure that they understand how to manage their own health through professionalism, innovation, and excellence in care. Max resources for benefit of the whole community. Make sure nobody's excluded, discriminated against, or left behind. We accept that most practices are the same in this. Treated equality. Interesting. In terms of the NHS Constitution, so in terms of the principles, where is it? Oh. So the NHS Constitution is to provide a comprehensive service to all, so don't discriminate, access to the NHS based on clinical need and also ability to pay, high standard of excellence and professionalism, just to ensure that patients are receiving the highest quality care. The NHS puts the patients at the heart of everything they do. So this is ensuring that you promote and you allow them to manage their own health and receive feedback and listen to it and welcome it as well. The NHS should work outside their organizational boundaries. So not being afraid to collaborate with other sectors in the best interest of the patient, and ensure that the NHS is committed to ensuring that taxpayers are getting the best worth of their money, and the NHS is accountable to the public. so many to learn.